watching Morning at NTV.
You do have 22 minutes to the top of the hour, 8 a.m. We do continue on with Wednesday's edition of Morning at NTV. I am Priscilla Regina Nalogan. Thank you so much for joining us. Now we're going to be having a take note in regards to health. Everyone talks about health in terms of medicine, hospitals. No one ever talks about literacy. And who should be having this literacy? The doctors, the practitioners, or even the consumers and the end users who seek out this medical aid here and there in whatever way that is. And so that's going to be a focal point this morning, health literacy, looking at things like prevention rather than cure. What do we need to know that can help us prevent some of these diseases, especially non-communicable diseases that have taken center root of our society? Now, the health-seeking behavior of a community definitely determines how they use health services, utilization of the health facilities, and this can also be influenced by the cost of services, the distance to the health facilities, culture beliefs, level of education, as well as health facility inadequacies such as stock out of drugs, among other things. However, there's been a growing call to emphasize prevention than cure, which then begs the question, what is the health literacy of Uganda, especially with the health sector that we currently have? We're joined by Dr. Daniel Tumwine, who is the team lead at Med Expo Africa events. He's also a pediatrician. He's going to be giving us more details about health literacy. So let's first start by saying good morning to you, doctor, and you're most welcome.
Good morning, Priscilla. Thank you for having me.
Okay, so what is health literacy in the first place?
Yeah, so health literacy, first of all, it's a very important concept in terms of the outcome of healthcare, both for the individual and the community. So I like the way you started the conversation, but generally it is the ability either of an individual or a community to access health information, understand it, and use it to change behavior both at a personal level and at a community level. And unfortunately, we have very low health literacy in our country, and because of that, it impacts negatively on health outcomes. For example, if you're unable to access health information, which the majority of Ugandans experience, you're not able, for example, to understand some of the signs and symptoms of disease. We know for a fact that very many people, and as you mentioned, I'm a pediatrician, but very many people do not know, for example, the signs of pneumonia. And pneumonia is the largest killer of children in the world of under 5. And if I asked a parent, many people think it's cough. It is fast breathing. And so when you're at home, you're not able to see your child breathing very fast, and then they have very severe pneumonia and they need oxygen. So health literacy, first of all, can lead to negative outcomes. It makes you delay to go to hospital if you're not able to understand and see some of the signs of illness. And when you do, because you have arrived late, the cost of healthcare becomes higher. Sometimes you find that there could be financial exploitation, because some people say, you know what, I need to travel abroad, yet actually some of the information or some of the services are available in Uganda. So health information going to the community is very important, and it empowers a patient. I remember when I started practicing, I was teaching PhD mothers how to breastfeed. So it has almost little impact on your literacy level. Of course, the poorer the people, the more unlikely they are to access good health information. And because the health information must be evidence-based, because sometimes you find that somebody goes on TV or on radio or does adverts about one drug, which is a wonder drug. And the reason that has happened is because many of the health consumers or the public really are thirsty for good quality health information. But the problem is there's a vacuum, and so you find that misinformation comes into the space, because people come in and say this is a wonder drug, and they're using it mostly for financial exploitative information. So it's important that we as health workers step into this space and provide good quality information, both in terms of services available, but also in terms of the illnesses that we have. So health literacy is really all encompassing. It's both at an individual level and also at a community level, because we know that a literate community usually has very good health indicators.
Dr. Tumwine, this information that you speak of, let me speak for myself. The expectation is that I can only and should only be getting this information when I walk into a health facility with a problem X, and the doctor is trying to diagnose it, and they give me this litany of options of what it could be or what could have caused it and things like that. And so that is society's understanding of health literacy. What you're trying to say is that a one Priscilla in Chivoga ought to be having some basic information on the fingertips, right?
Yes, because you notice, for example, just when we came out of COVID, one of the key things was having either the president or influencer people, you know, whether it's a religious person, whether it's a cultural person, coming out and actually teaching us about COVID. Because you have to understand who are the influences of us. So for example, where do you get your health information from? You can find that it is cultural. So my grandmother would tell me, when you get a cough, this is the herb to use, or when your child is born, or when you're pregnant, use this. Now some of this might be helpful, half of it might not. You have your peers, many of you have WhatsApp groups, other people up country or whatever are in the village market talking about health. So how do you make sure that those people, when they're talking about health, the health they're talking about is accurate? Okay, so that's why I'm saying we get information from different places. Yes, we get them from health centers, but how long do you spend with your doctor? Okay, if your doctor says take this tablet 2 times
The doctor
1,
has to make money, so he has to push me out of the room because he's dependent on how many people walk into his room.
So even if he talks and says take this tablet 2 times 1, what does 2 times 1 mean? Even me, sometimes I get confused because, so the language we use.
And at what point should the second dose be taken?
Yeah, so the language we use, the information we give should be patient friendly, it should be good and accurate. And so the reason that health literacy is so important is because understanding health empowers this patient. If my father gets a stroke, where do I start? Okay, and those are questions that the public will want to, you know, if my child has cancer, first of all, do we even know how that will look? And you might find that actually if you go early to a cancer institute or some other place where it provides cancer, many of these childhood cancers can actually be cured. Okay, there are health facilities that give free care for certain people. So for example, in Entebbe, there is the Children's Surgical Hospital. If your child needs a surgery, free care. Okay, in Bali they have an amazing institution that helps children, for example, who have neuro complications. But half of the people there are not even Ugandans, so people fly in. There used to be a good hospital in Khartoum before the war, for example. So there's a lot of information that needs to be
on that point. The feeling that society gets is that this information is kept to the holder of or the custodian of this information for their self-benefit. For example, if it's government, it has this information. The 2 hospitals, I've had the privilege of relating with the one in Mbale, but again, how we found out was through another friend to my cousin, instead of the health facility to which we were going to seeking for, you know, this particular medical aid. And so it seems to be that this information, much as it's there and it's free and it's accessible, the ones that are custodian to this information hold it against the public, against society for benefit. What is that benefit?
I'm not sure it's done deliberately, but I do know, for example, that we're working with the Ministry of Health and they're trying to catalog who provides which service and who doesn't. But you see, there's not been a concerted, deliberate effort to give information, okay, to the public, because once a member of the public is empowered, then they're able to make choices, informed choices, and then they are also able to, as we said, you know, not be financially exploited. So the idea is empowering this person. My professors used to tell me 50% of management of asthma, of cure of asthma, is educating the parent. Okay, if the parent is at home and they understand the signs and symptoms of asthma very early, more than even the doctor. So we are coming into this space and saying, let us be very deliberate in educating people beyond just campaigns. Yes, campaigns do work. For example, if you remember when HIV was very high, there were very good campaigns which were very topic specific. okay, when Ebola came, when, as I've told you about COVID. But how do we have a culture that permeates, where the whole society on a regular basis, on a sustainable basis, we're able to improve its health literacy? Because once you've done that, there's a study, not necessarily in Uganda, which was done that for every dollar that you put into health literacy, you save $25 in care downstream. So this is a very good and effective way to actually prevent illness and also be more effective in terms of providing healthcare.
Okay, you've talked about exploitation. You do have the conventional way of medicine. You have the unconventional way of medicine. There's been a huge gap in there that has caused people to actually either use both of them at the same time, which I believe is lack of literacy, or opt to drop the conventional to go for the unconventional in the hope and the testimony of so many other people, which has caused a lot of backlog and backlash for the health sector. Talk to us about that.
Maybe more clarity would need on that question, but I do know that many people think, and it's really not true, that there is a chasm between Western medicine and non-Western medicine. But that's not necessarily true. So many people do choose to use non-Western medicine. Why? Because the information and the treatment that they get from that end, it's not a I know all, it's really understanding the patient as a whole. And however, Western medicine, of which I'm an advocate, and I'm also an advocate of traditional medicine, because I keep saying, some of these anti-malarials that we take, these are herbs. These initially started off as herbs. But how do you make sure that the herbs you're giving your child, or your pregnant daughter, or your pregnant one, actually not going to cause harm? Because we keep saying that, for example, that all drugs are poisons, and the tenet of medicine is do no harm. So how do you ensure that if I'm going to get a drug, and it's not necessarily in the Western medicine circles, it is actually safe? And that's why we say, let's take all these Western, non-Western medications, or Western whatever, and do research, okay, so that somebody can confidently refer you. Okay, some of these bone setters in the traditional villages, these are important people, because their methods actually do work, and that's why people go there. So our issue is, if something works, it has evidence backed by it, can we popularize it so that the patient is empowered? And that's the key thing, whether it is in one area or not. So that information we're giving is accurate. It is not a myth. It is not something that is hard from the masses. Because when we in Kampala, we ask around, where do I go with this and this? We always ask our friends, and they'll say, oh no, last time when I got this drug, it helped me, please also take this. So one of the consequences, for example, of poor or low health literacy is that you end up misusing drugs, you end up having side effects, okay? And because you're now using these drugs, you don't actually go to proper care. So one of the things is, by understanding your health literacy choices, how are we able to empower your public?
Okay, let's talk about self-care, which is something that you've hinted on. This and the use of traditional remedies has been categorized under the healthcare, but largely discouraged by health workers. Why is that so?
Which one, the traditional one?
The traditional remedies, and also self-care or self-treatment.
Yes, so first of all,
because if I have this information, then that means that I can easily access drugs according to the information.
No. Part of health literacy is telling you that drugs are a poison. Actually, a person who understands how drugs work should actually be scared of drugs. And I keep telling the public that drugs should be used very sparingly, okay? Only in the need, or only when they are needed. Okay, and no, as I keep saying, we don't discourage traditional herbs. As I said, there are herbs which actually work. The only thing we need is data, good clinical evidence data, and we've given examples, for example, the anti-malarials, we've given examples like other medications which actually do work, but they must be backed with data. So many times when the health workers come in and say that don't use this drug, it's because there is no evidence, okay? Imagine you give your child a certain herb, and actually that herb has toxicity to the heart. Okay. Yes, right. It will help. Yeah. Yes, it will help with the flu, but it can cause toxicity to the heart. Or the side effects are not known, and you're giving something, your child, something of whose toxicity is not known. So that is where we are coming from. And so we always encourage, can we actually encourage you to do some studies?
Yeah.
Okay, because when we say we're giving information, it is evidence-based. And remember, self-treatment is not good. So when we're doing health literacy, we're not asking you to go and treat yourself. Okay, we are saying, if your parent gets a stroke and they go home, how are you going to understand that your father is deteriorating? How are you going to understand that the physiotherapy services are available or the speech services are available? So that's the kind of health information we're trying to give out.
Okay, all right. In this regard, I understand that you have organized a campaign, a 3-phase campaign, and you're doing an expo in this regard to just really build the momentum of Ugandans in better understanding and taking charge of their health literacy. Talk to us about that.
Yeah, correct. So we're really a group of, want this thing to be private sector led, but we're working with the public sector as well, including the Ministry of Health, where we actually have a 3-phase campaign. So we have a campaign where we exploit both traditional and non-traditional media. So we go online, we also write articles in the newspapers, we come to radio stations and television stations like these. And this is basically to reach out to the people who utilize this media and really just put out good quality healthcare information out there. Then of course the last 2 phases, which is phase 2, really we are engaging with the public physically. So we have a medical expo which is going to run from the 7th to the 9th of September. In here we are bringing prominent health professionals to come and give talks to members of the public. We're inviting health institutions like hospitals. We mentioned the ones in Bali and the ones in Entebbe. Can you come and engage and network with the public? So we're calling that more of a knowledge and networking event, so that anybody's free and able to come and just engage and network with the health workers. And then after that, we as health workers go into communities. So we're going to schools, we go to religious institutions, we're going to marketplaces, and just have a conversation about health literacy while passing on good information in that. So that's really the scope of our campaign, and we hope to have this annually and invite people to come and make this a sustainable annual feature for our society.
Okay, so for participants' side, how do they get to participate in these campaigns?
Yeah, so for example, for us, so right now we're doing online live shows both in Luganda, in vernacular languages. Almost we're churning information out weekly. Okay, for the medical expo, it is going to be at Lugogo. You just come in. There will be health experts who are able to talk with you, health institutions who talk about very important and pertinent health topics.
Okay.
When you fall sick, where do you start? And then of course working with the ministry, after that we will be very deliberate in going into different marketplaces, in communities, and just giving out good information about healthcare.
All right. Thank you so much, Dr. Daniel Tumwine, who's the team lead at Med Expo Africa Events. Of course, you can just type that into your Google search engine, and it will be giving you the further details on how you can catch up with these different health campaigns and get to watch them or participate in them or inquire thereof for any information that you need. Now, we're going to be